Well, good afternoon. As we reopen the economy, the health and safety of everyone remains our top priority. As more businesses open their doors, Ontario employers are going above and beyond. Across our province, business owners are doing the right thing. They're taking necessary steps to protect their employees and customers. Businesses are putting up plexiglass barriers, providing masks to their employees, and sanitizing surfaces frequently. We should all be proud of our incredible businesses for their leadership. These steps are our best defense, while ensuring people can take home a paycheck again. And that's why our government is doing everything we can to support our businesses as they reopen. And today, I'm here to announce that we are providing free health and safety training online for the first time ever in Ontario. This initiative will allow up to 100,000 job seekers to take free online workplace health and safety training through Employment Ontario. This training will give employers the confidence that they are hiring someone who knows how to create and maintain a safe workplace for customers and other employees. This is good for business confidence, and it's good for consumer confidence. Building the confidence is absolutely critical to getting our economy going again, and we couldn't do it without the support of our incredible Ontario businesses and without the support of the people of Ontario. And before I pass it to Minister McNaughton, I want to take a moment to recognize our brave men and women in uniform from the Canadian Armed Forces. They're finishing their mission today in Ontario and departing from our long-term care homes. I just want to thank you from the bottom of my heart for helping us out through this very difficult time. These are heroes who walk among us. We're so grateful for everything you've done. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister McNaughton.
Well, thank you very much, Premier, and good afternoon, everyone. As we continue to safely and gradually reopen the province and thousands of people get back on the job, we want to prepare them to return to work safely. By providing critical online training for free through the Employment Ontario network, this $3 million investment will help up to 100,000 people learn in the safety of their own homes. The courses cover topics such as infection control, ladder safety, and preventing slips, trips, and falls. These courses will provide job seekers with the confidence to safely enter or return to the workforce. We're also making it possible for people currently working who are members of workplace joint health and safety committees to take their training online. Training will be available in real time through video conferencing with qualified instructors. The courses will cover how to establish a committee, resolving health and safety issues, workforce inspections, and accident investigations. To find training, visit ontario.ca/employment or contact Employment Ontario at 1-800-387-5656. More and more training is moving online. I'd like to point to Skills Ontario, which is doing a great job of adapting to our new circumstances. Earlier this week, our government announced we are investing an additional $3.5 million in Skills Ontario. And that's a good investment because their mission is to promote the skilled trades to young people. We know our labour markets are changing, but the need for skilled trades is not. They're doing not just online presentations, but virtual skills contests and summer camps. Today's announcement is another example how we can make things safer and easier when we adapt. When people take health and safety training, they not only make working safer for themselves, they learn how to keep others safe as well. As we head back to work, more than ever, safety is top of mind. This is something Ontario's Chief Prevention Officer is focused on. Our ministry, the Chief Prevention Officer, and Ontario's health and safety organizations have to date posted 139 sector-specific workplace guidance documents. We posted an additional 40 posters and tip sheets. You can find them all at ontario.ca/COVID safety. There are steps that we can all take to keep ourselves and others safe. It's because of the way we've all pulled together the last few months. I have every confidence we'll make it the rest of the way together. Thank you.
Okay, we'll go to the phone line for questions. First question.
Will be from Colin DeMello at CTV News. Please go ahead.
Hi, Colin.
Hi there. Good afternoon, Premier. It's been 3 weeks today since parts of the province entered stage 2, but there are many other sectors, as you know, that are still on the sidelines. Gyms, fitness studios, yoga studios. The number of COVID-19 cases has been on the decline and steady below 200. Why are we not yet in stage 3?
Well, we're moving cautiously, Colin, to be very frank. We want to make sure that numbers continue to decline. We've been, everyone, when I say we, I talk to the people of Ontario, have been doing a great job in making sure those numbers decline, and we'll get there. We'll get there very shortly. It's in front of the committee. Committee goes to the health table, and then the health table will have the final call on it. But since it's going to be the last stage, we want to make sure, again, our T's are crossed, our I's are dotted, and make sure everyone's safe, and they'll be able to move forward on other areas of the economy.
Thank you, Premier. And just to follow up, can you give us even a rough timeline? Can you say that we'll enter stage 3 as a province by the end of July? And what do you say to all of those businesses and business owners who are literally losing their livelihoods, going bankrupt, having to close down their businesses because of the province's actions thus far?
Well, I wouldn't, first of all, you're pretty close to the end of July. I just don't have the crystal ball. I can't give you an exact date. And I think your last comment was to blame the province for shutting it down. Something, that's just not the case. We're doing everything we can. We're moving responsibly. We're leading North America with the lowest cases for any jurisdiction our size. And you see what's happening when you move too quickly. You see what's happening south of the border. We don't want that happening up here. We're trying to do everything we can to open up safely, and that's our number one concern. Open up safely, cautiously, and then when everyone opens up, we're going to go full steam ahead on the economy by cutting red tape regulations, making sure there's incentives to continue moving forward and being competitive in the global market.
Next question.
Will be from Lucas Meyer at News Talk 1010. Please go ahead.
Hi, Lucas.
Thank you very much. Good afternoon, Premier. On education, I wanted to follow up after the memo that was sent to boards a little bit earlier this week, recommending that they prepare around that September 1st date, bringing in those those professional development days to prepare. There's a lot going on right now with, the 3 options that they have to give at the beginning of August, and new math curriculum, et cetera. Yep. So but on the school start date specifically, what is your ideal date to start the school year?
Well, we're leaving that up to each region, and I want to give a shout out to Ottawa, the school board in Ottawa. They're fantastic. They already have their whole systems put together, protocols in line, so they're champions. They move quick, and they have a good guidelines there. But we're going to leave it up to each region. As for the September 1st memo that came from the Minister of Education, we've been out of school now for 171 days, physically out of school. We still have the kids learning, but it's been a long time, and they want to get acclimated to going back to school. That was a suggestion. No one's going to put a gun to anyone's head. We'll leave it up to the regional school boards to make that decision.
Thank you, Premier.
Thank you.
And my follow-up question has to do with a story that we just learned about not too long ago. There's a bar here in Toronto that's been suspended by the AGCO with the move to revoke their license. They're facing charges from Toronto police, alleged to have had no social gathering, and about 125 to 150 people inside their establishment. I just wanted to get your reaction to this, and what would be your message to those who were in that establishment in terms of getting tested?
I just say, guys, don't do it. I heard about this. They were going in through the back door, if I'm not mistaken, and the police drove by and saw a whole bunch of people going in there. Why risk it? You're smarter than that. What, to hang out with 150 of your pals? It's not worth it. It just isn't. Just hang in there for a little bit longer. We're doing such a great job. And just imagine, all it takes is one person in that bar out of 150, gives it to another, and it's just rapid fire. Then all of a sudden they go home and they go visit their grandparents or their elderly parents. and you're putting your family at risk. You're putting your friends at risk. Why? What, over a couple drinks? Not worth it. Just not worth it right now. Just hang in there for another little while. We'll get through it.
Next question.
Will be from Sean Jeffords at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I'm wondering if you can confirm reports we're hearing this afternoon out of Windsor, Essex, that the province has deployed Emergency Management Ontario, or a team from Emergency Management Ontario, to the region to deal with the migrant worker outbreaks on farms. Can you tell us about that and what role they will play down there?
Sure. I'm going to, before I pass to Dr. Heyer, we did deploy EMO down there, along with the Red Cross, along with Ontario Health and Public Health. It's all hands on deck down there. I just got off the phone on a conference call with the farmers, with all Public Health. Dr. Heyer was on the phone as well. I want to try to help them. I feel terrible for the situation that they're in, and it's a real, unique situation that the workers that are just trying to earn a living and put food on our table, the farmers trying to keep their farms afloat, and then the docs down there that are trying to keep everyone healthy and being cautious. But we had a conversation, and we're going to be working over the weekend to make sure we continue keeping the farms going to the very best of our ability. And I just want to say it's no one's fault at all. This is moving at rapid fire. I know there was information that came out the other day about people not getting tested and everything. That I apologize, misinformation, but I want to thank the farmer. He's an incredible person. I spoke to him today. He's an absolute champion, and all 182 people are getting tested. They're working with us, and I think the world of our farmers. I think the world of our workers and the poor folks in Kingsville, Leamington. We're doing everything we can to get this. Get through this. We've had hurdles in the past before. We all stick together. We all continue communicating. We work together, and we'll get through it. But the real champion is Dr. Heyer. He's driving the testing. He's doing a great job. So I'll pass it over to the doc.
Thank you, Premier, and thanks for the question. As the Premier commented on, there has been a number of things mobilized in Windsor, Essex. I was involved with the testing of the farms and continuing to do that of farm workers, and that opportunity remains both from a testing point of view but also as a health opportunity. All hands are on deck, as the Premier said, to ensure the health and safety of the workers and the best possible way to have the farms continue to function.
Okay. Follow up?
Premier, I just wanted to follow up with a comment you made there just a moment ago and your comments yesterday. So are you saying that you received misinformation when it came to your remarks, or that led you to make your remarks yesterday about workers hiding from testing efforts on the farm that had an outbreak?
I did receive misinformation, and I'm a true believer. When there's misinformation, you stand up here, you apologize, and you move forward, and you work with the people. And that's exactly what I believe in, no matter what it is. Be transparent. Tell the people exactly what happened, and that's what I'm doing here.
Next question.
Will be from Travis Stanraj at Global News. Please go ahead.
Hey there, Premier. How are you doing?
Good. How you doing?
I'm good, thanks. Question about beaches. Now, we saw across the province beaches were jammed on Canada Day, including Wasaga Beach, Woodbine Beach, Cherry Beach, where many people were ignoring physical distancing guidelines. You have said previously, I think it was in relation to a question that Randy had asked you, that you won't hesitate to shut beaches down if needed. Based on what we have seen over the past few days and the past few weeks, are you now at that point where you're thinking about shutting beaches down?
Well, I'm leaving that up to the chief medical officer, the local chief medical officers. I know up in Wasaga it was absolutely packed, and they're doing it up there, but we aren't going to be closing any Ontario provincial beaches right now. But again, I just ask the people, it's common sense. You go to a packed beach, find another place if it's jam-packed. I wouldn't go to a jam-packed beach. Find a more secluded beach. We have a lot of provincial parks around the province that are open right now, and they may not be as busy as more popular beaches, the ones you just mentioned.
And just as a follow-up to Colin's question about stage 3, so you were saying that this is the last stage. Does that mean that all of the remaining businesses that are shut down will be able to fully reopen? And to Minister McNaughton, on the question of enforcement, are you confident that you have enough manpower when it comes to inspections and enforcement that these guidelines will be maintained?
Everything except large venues, be it the Blue Jays game, we can't have 50,000 people, rock concerts, any concerts, a hockey game, so on and so forth, but most all businesses will be able to reopen. I'll pass it over to the Minister.
Well, thanks so much for that question. I can tell you that the business community has really stepped up to protect the health and safety of their workers and the public at large. Our ministry is working every single day communicating the guidelines to businesses to help them out during this difficult time and lots of change happening because of the global pandemic. We have increased the number of inspectors to 500. I'm proud to say that they're working hard. They're helping protect the health and safety of workers in Ontario, and we have inspected 13,000 workplaces right across the province to help improve safety for workers.
Next question.
Next question will be from Laura Stone at Globe and Mail. Please go ahead.
Hi, Laura.
Hey, Premier. I wanted to ask you about your comments about the misinformation. Who gave you that information? Was it the farm? Was it the farmers themselves that these migrant workers are hiding from testing? And what specifically is your government doing to communicate directly with these workers? Are you using translators, and are you going to them directly? Are you getting all your information from the farmers?
Well, we get information from everyone, but let's address this. Nothing burns me up more than if I get misinformation. I tell the people it's my duty to come out here and set the record straight, and nothing burns me up. And that rarely happens, but when it happens, we have to address it. And I have been in communication with the farmers. They're great people. They're working hard. This is moving like rapid fire, and it's very fluid, moving very quickly. But we have all hands on deck, and we all agreed, the farmers, the health team, ourselves, we all agree we have to keep communicating with each other, making sure we resolve the problem. A lot of these farms don't only ship up to Canada here. They have massive customers in the U.S. relying on the goods that are coming from Ontario. It's a big business, and I'd hate to see the Americans do, not on purpose obviously, but shut down food coming to Canada. Food is critical, and we're going to get over this. We're going to get it resolved because everyone's working together, and it's no one's fault. It's this COVID-19 came in there, and we're locking it down. We're getting it done together with the farmers, workers, and with the health team.
And on long-term care, with the military having now departed, I think a lot of members of the public are waiting for the commission to start. They want to know what is happening in long-term care, how the staffing crisis is going to be resolved. So why is it taking so long for you to announce details of the commission? Are you having trouble finding someone lead it? And who are you looking to set the agenda for your commission?
Well, we'll be coming out with that sometime very shortly. We just want to make sure we have the right folks and the right person leading this. I want to be fully transparent. Not only are we doing a commission, we have the Auditor General doing it, along with a wide range from the Coroner's Office, the Ombudsman, a whole group of different independent folks will be looking at this. And the goal is to come up with solutions to make sure this never happens again. I could sit here and tell you the reason all day long that this has been neglected for decades, but what does that do? We want action rather than cheap talk. Everyone up there talk. Let's get some action done. We're doing everything we can to put in the proper protocols and procedures to make sure this doesn't happen again. We've supplied enough PPE to each and every long-term care home, and we'll never face this problem again because we aren't going to rely on foreign governments to cut us off like they did before. We have manufacturing that's going to be up and rolling in the next couple of months with large suppliers of face masks, I should say, and face shields and hand sanitizer. So we're going to have the Made in Ontario approach, which we won't face this problem again with PPE. So I'm looking forward to it because I need to make sure that we have the proper systems in place to protect the most vulnerable people in our province.
Last question.
Will be from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Premier.
Hi, Rob.
Just wanted to follow up on Sean's question, and you may want to flip this to Dr. Heyer, but
Yes.
what exactly is EMO, Emergency Measures, doing in Windsor, Essex right now? What actual functions are they performing?
We have 2 supervisors on the ground. We're helping direct Red Cross, working with Red Cross and working with the farmers. And I think they're very talented people in EMO, and they do a great job. And I just appreciate them taking their time out. I always say we can't have enough people. We need more expertise down there supporting everyone that needs help. I'll pass it over to Dr. Heyer.
Yeah, the Premier has made most of the remarks, but the Emergency Management Ontario and the Provincial Emergency Operations Centre have the capacity and the role to support different areas of the province when there are greater needs for coordination, greater needs for urgent response to things. And the team is providing support for the workers from the one farm where there was the notable number of positive COVID findings, as well as those who may have been in contact with those positive workers. And they're helping to coordinate, the EMO is helping to coordinate to make sure that the workers have the best care, the best housing, the best accommodation, food, and support, both from a psychosocial point of view and a physical point of view, really to ensure that they're safe and healthy through the 2-week period of time while they're hopefully not becoming infected or symptomatic from the COVID-19. So they're taking a leadership role with that and coordinating all of the different activities. They're experts in that, and they provide great support and great coordination for everybody.
Just to follow up then, are all those workers from that one farm, for example, are they all being billeted in hotels? Who's paying for that? Who's paying for the food? And all those other services?
Yeah, there's a number of approaches that are being taken with all of the different workers. I don't have all of the details of exactly how they're all being cared for, but there are a number of workers who are being looked after carefully within hotel settings, and then there are some that are on the farm. All of them are being carefully monitored through a health perspective and also with support from various others that are present, again with appropriate support from a language translation and appropriate health care.
Thank you, everyone.
Thank you. Have a great weekend, everyone.